So picking up where we left off, I was listening to the heart sounds. I will now flip my stethoscope over to the valve to listen for any valve clicking, gallops, or murmurs. Aortic valve, pulmonic valve, tricuspid valve, and the mitral valve. S1 and S2 is present. S3 and S4 is not present. No gallops, murmurs, or valve clicks. I am now going to be assessing the abdominal area. Slightly rounded. Umbilical is midline. No signs of distension. I am going to listen for your bowel sounds, hyperactive or hypoactive. If bowel sounds were not present, I would listen for a full 5 minutes. I'm going to start on the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are normal active. Now I will be moving on to the upper extremities. I am assessing for temperature, any signs of edema, which there are none. Skin is pink, no signs of dryness. I'm going to be looking for tenting in the skin, which would indicate dehydration, which I don't see any. I'm going to be looking for capillary refill for oxygenation, which should be 3 seconds or less. Visual inspection of the skin, no lacerations, wounds, masses. I'm going to be testing for your grip strength. Squeeze as tight as you can with all of your fingers. Okay? Now go like this. Pull towards you, testing arm strength, out towards me, to the sides, and towards the middle. Okay. Strength bilaterally. I am also going to be looking at your brachial pulses. 2+ bilaterally. Radial pulses. 2+ bilaterally. Okay, good. Now I'm going to be moving on to the lower extremities. I'm going to move the camera so you can see. Okay. Put your feet down. Now to feel for the femoral pulse, I would be placing my hands right here. Upon visual inspection, I don't see any lacerations or wounds. Symmetrical, bilaterally. I'm going to be feeling for any signs of edema, pitting edema, no edema present. I'm now going to be feeling for the popliteal pulses. 2+ bilaterally, dorsalis pedis, 2+ bilaterally, and the tibial pulses, 2+ bilaterally. Now I'm going to be looking at the capillary refill, which should be 3 seconds or less. Good. No lacerations or wounds on the feet. Now I'm going to be testing the strength of your lower extremities. Push out towards me, in towards you, in towards you, in towards you, out to the sides, and towards the middle. Strength is good. Now I'm going to be testing your dorsiflexion and plantar flexion. Put your feet up, down, okay. Now I'm going to have you press on the gas pedal, okay, and up, good. And that is the end of my assessment.